Good morning. This is the Blainsville webcast that can be found each week on Facebook, YouTube, and LinkedIn. You can also find us on Spotify, Apple Podcasts. You get more information and listen to previous shows at our website, which is behind me, blainsworld.net. I'm your host, Blaine Greenfield, and I'm here in my Zoom studio in lovely downtown Fairview, North Carolina. Each week, we focus on positive news and information that people and organizations in both Western North Carolina and third country. And toward that end, it's my pleasure to introduce Chandler Schroeder, who's head of operations at Visiting Angels. And thanks for being my guest today, Chandler.
Yeah, thank you, Blaine. I'm excited to be here.
Okay, and by the way, you can wave to all your fans and friends who are watching this.
Everybody
Okay,
that knows me, it's not that
okay,
many.
excited. That's Chandler. Chandler Schroeder has been a leader in home care, home health, and hospice since 2008. With extensive experience, he is currently head of operations at Visiting Angels, one of the largest non-medical home care franchise organizations in the country, where his focus is on building scalable systems, strengthening operations excellence, and driving sustainable growth. So the question, Chandler, I always ask when I speak to somebody for the first time is
Yeah.
as a kid, you grew up where?
In Greenville, South Carolina.
Okay. And growing up as a kid in Greenville, South Carolina, did you always know you wanted to be involved in home health care?
Ironically, I did.
Like, oh, wow.
Yeah,
Okay.
yeah.
How so?
So I'll go back to undergrad when I first started, in high school and starting into college. I wanted to be a physician. I wanted to be a surgeon. I just had a fascination with medicine. But my family was involved in home health, hospice, and home care long before I was even a figment of their imaginations, before I was born. So I grew up working every school break, every holiday for the family business, which was a home care, home health provider. And so I've seen from literally my infancy on the amazing difference that this service can give to people in their homes. And I've decided to make my entire career out of it.
So then you went to college for to study what?
I started pre-med, then I realized that weekend parties and camping was more fun than lab. So I ended up transitioning to business, and I got an international economics degree with a minor in English.
Okay. And then, so what was your first job after college?
So my first job after college was actually because, again, I was a finance guy. I worked for Morgan Stanley, first as an intern and then as an entry-level FA, financial advisor, where I sat for all the exams and tested with FINRA to be able to work, with people's finances. And honestly, worked there and also worked at Merrill Lynch and just never found fulfillment in that. I mean, it was great working with clients and explaining to them how we can grow their money and all of this, but I kept feeling this tug of like, we're not really helping people. We're not really helping them, age in place or anything like that. And started seeing also, this is kind of the dual view of my career, is I'm able to see what people spend on healthcare from a truly fiscal standpoint, because that's what I used to do. So being able to help people manage that pot of money they have as they get older to make sure they get the care they need is kind of how I'm able to implement a little bit of my schooling into what my passion is in home care.
And so, how did visiting angels come onto your radar screen?
So actually, I had taken a couple years away from home care. I had worked for Interim. I had worked for Medicis, which is a big national home health hospice agency as vice president, and then worked for another home care agency franchise in the area as their chief operations officer. I took a couple years away and actually went on and received all my training to be a counselor and work with folks with mental illness and substance use. Just something that's near and dear to my heart, and I wanted to do something in that field. And about a year and a half ago, received a call from a recruiter who said, "Hey, we heard your name, and would you ever come back?" And I said, "Well, I've got some stipulations to it now. I've got a big family, and I've got kids, and I've got a partner, and I can't travel 4 days a week." And the opportunity with Visiting Angels presented itself, and it's funny. It's the one organization that I had said throughout my entire career that if I ever had an opportunity to work for Visiting Angels, I would. And I got it.
And so, you've been on with visiting angels for how long?
I've actually only been there since the middle of September.
Okay, in the current position you have.
Yep.
And so, for the folks who don't know what visiting angels are, if I can ask you to do so in, say, under 2 hours, if you know,
Oh,
we'll
that's
do a
all.
little bit more. But I've been researching it also and very impressed. What is Visiting Angels all about?
So Visiting Angels is a non-medical home care agency. And what that means is that we're still licensed. We still have to go through state licensing procedures. We have a licensed director. We have a nursing director who oversees all of our cases, but we don't provide medical care. So when you think of somebody coming into the home to help, let's say mom or dad, and if that's a nurse or a therapist that comes in, that's home health. And people get that confused. Home
Right,
care is what we do. And that's a what we call a PCA, personal care assistant, or a care professional, also certified nursing assistants. But the people that come into the home to take care of folks when they have, gotten to the point where they need a little bit of extra care. Um, we might just be there as companions, just to be there with the client and you know, uh, do jigsaw puzzles and play boggle and read the newspaper with them and just talk because, it can be lonely, especially as you get up in age and maybe you don't have family around. Um, so we do, of course, the companionship and all that, but really what I love to see our caregivers do is getting involved in that client's life, knowing what they like, what they don't like, maybe helping them get to church, maybe helping them keep their house the way they like it. At Visiting Angels, what we do is we focus on the ADLs, which are activities of daily living, moving around your house, showering and bathing, meal prep, things like that. Um, and we focus on all that. And then we also focus on, staying safe in the home and staying as active as you can, because sometimes, if too much care is given to you, then you kind of stop doing the other stuff you did. So going to play bridge once a week or going to your book club or whatever it might be. If you're not able to do that anymore, then you're losing that part of who you are. So at Visiting Angels, we provide transportation as needed to doctor's appointments or community groups or church or whatever's needed. Um, what I love most about it is the fact that I'm able to be part of dozens of families all at the same time by just taking care of one of their loved ones.
and
And from where I sit, that's the greatest blessing in what I do.
and what I'm hearing you say, which is kind of interesting. So I think about people oftentimes on long-term care, and they'll get medical assistance, and
Mhm.
those folks, and I've had this with my brother-in-law now, can't do other things for people. In other words,
Right.
and it's kind of frustrating. So somebody will have somebody there in the house, but all they can do is just take care of the medical needs, but they don't
Hmm.
do some of these other things like, I guess, laundry or you name it.
Right.
So
Exactly.
Visiting Angel can do all this stuff.
Absolutely.
One of the great names, I think, for an organization, Visiting Angels. How long
Yeah.
has the organization been around?
So Visiting Angels as a company has been around, I guess, around 30 years,
Okay,
if I'm not mistaken. The franchise here that I work for has been in Asheville for 23 years. And Jerome Bouillon, who is my boss, who's the owner director of the franchise, he has had the Asheville market since 2017. And then he purchased the Lenore area, which is like Hickory,
right.
Morganton, Rifferton, that area, back a couple of years ago. So it's still kind of a baby franchise. But all in all, yeah, they've been around for over 3 decades.
Now, Chandler, how does this tie into then long-term care? So if folks have long-term care, do they work with you as
Mhm.
well?
Yes, absolutely. So people get a little confused with it. And unfortunately, we had a rash of kind of negative long-term care policies, meaning ones that were written that somebody got sold on that really doesn't pay anything back.
Right.
But we're starting to see those fizzle away. And now, just based on the demographic, we're starting to see policies that are very worthwhile. And so, how it works is for us, for instance, if you need care at home, and so you call and you say, hey, or let's say it's for mom, you call and say, you know what, mom needs some help at home. What do you guys do? We'll talk to you about our hours. We do have minimums, but we'll do a 1 hour minimum,
Wow.
which no other agency will do. But with that comes a 6 hour per week minimum in order to, guarantee the pricing and we have to be able to schedule our folks out. and give them jobs as well. So we do have that 6 hour a week minimum. But the great part about long-term care is if you have a policy and you're wondering, hey, is this going to help me, or can this help with what we need at home right now? We will actually take that policy, we'll read through it. I've got some folks that are experts at how long-term care works. And so, for instance, with long-term care policy, there's a thing called an elimination period a lot of times. People don't know that exists, and it might be following one midnight in the hospital. So following one stay at the hospital, then it turns on your period, and it might be let's just say it's a 30 day. There's a 30-day elimination period, which means you have to pay out of pocket for those 30 days. And then at which time, then we would take it over and we'd continue to provide the services. And what we do is we send all the information to the long-term care company to reimburse the client. So the client still pays out of pocket for it. It's called a pass-through program. They pay what our invoice fee is, and then we send everything to long-term care. Long-term care pays them for that.
One of the nice things I would imagine working through visiting angels is also somebody's not restricted like you are with long-term care policies, meaning that long-term care, they have all these restrictions. You have to 3 out of 5 or whatever the number is. You
Right,
can't,
of the ADLs, yeah.
right, you can't get help. But if you call visiting angels, I guess there are, you're paying for it, but there are no restrictions as to who can get help from visiting angels.
Well, no, I mean we focus on the senior population.
Right.
So I mean, for all intents and purposes, the age of 60 to 65 and older is who we take care of. We don't do pediatrics. Some places will do pediatric in home. We do not. So we deal with adults and usually those of Medicare age. Now, I do want to mention, because I said the word Medicare,
Right.
that Medicare itself does not pay for home care services. They pay for home health services. And that has to be, I mean, actually written like a prescription from a provider, from a doctor or nurse practitioner or a PA. They write for home health, and that's when a nurse or a therapist comes in. That is paid for by Medicare, but our services, home care services, are not. I just always want to be very clear with that.
So even if, so a doctor, or I'll ask you, can a doctor recommend and they do, home health care?
Yes, so home health has to be written for. So if you go in and let's say that you have a partial hip replacement
Okay, good
and
example.
you're 70 years old. And so you go in for your partial hip replacement. When you get discharged home, your surgeon or the hospitalist, but one of the physicians will have written an order for home health. And home health will then send in a nurse. They will send in therapists. They will send in home health aides to help with bathing or something like that. But the most you'll ever get is one visit a week, and that's not even for an hour.
And
So,
what's wrong with that picture? And so
right,
you'll
exactly.
never get, and the thing that's perhaps needed most, as you were saying, is the home care,
Mhm.
help. And so that's not covered, unfortunately, by Medicare.
It's not, no, but there are payer sources. So like long-term care, like we just talked about. There are some grant sources that are out there. So there's areas that are called the Council on Aging.
Right.
And so anybody who's interested and wants to know if there's maybe some government subsidized funding out there for the services, they may have something. It's worth the ask. We wouldn't necessarily know that, but we do accept that. Then the other one to think about is Veterans Affairs, the VA. We are a very, very veteran-friendly agency. We love working with our vets. And for the VA, there's two programs. There's one which is the Homemaker Companionship Program, and there's one that's called Aid and Attendance. The one we see the most of is the companionship, and what that is you would a VA beneficiary would talk to their case manager or social worker at the VA, whoever it is that they're dealing with for their care, and mention, hey, I might need some help at home. They'll walk them through the forms that need to be filled out and whatnot. That gets sent to the VA. The VA approves a certain number of hours per week, and then we pick that up and take care of the client. So nothing comes out of pocket for the client.
Which is nice.
Um,
Yeah.
yeah, and they're given a certain number of hours. And so we just base our care on those hours. So the rate that's billed for that is negotiated with the VA. So the client never has to get involved in that. They just know I get 12 hours a week and Visiting Angels is coming out here 12 hours a week.
Well,
And of course, our schedule is what the client wants
you were telling
always.
me off the air, Chandler, I thought it was
Yeah.
kind of interesting too, that when people think about visiting angels and looking at the website as well, but
Mhm.
just give a kind of an overview of the kinds of things that a visiting angel can do. And what's kind of nice compared to a nurse, you and I were talking about this, that
Yeah.
there are all sorts of restrictions. You know,
Right. Yep.
I told you, I can't believe it, that my brother-in-law has nurses come in and
Hmm.
they can't do anything beyond change bandages or whatever. Whereas a
Right.
visiting angel, it's pretty wide open what they can do.
It's pretty wide open as long as it's not medical. So, like wound care. Obviously, we don't do wound care. But everything else that you can think of that would keep you safe, independent, and with as much integrity. That's something that drives our franchise is that word integrity. In everything we do. And I mean, in our billing, in our how we schedule, everything is with the highest integrity. And that's because the people that need our services, Blaine, like you're saying, they need more than just wound care. So we can come in, we can help with light housekeeping. We can do up to 30% of our visit can be done as a housekeeper. Although we're not housekeepers, we're care professionals. So with that comes meal prep, helping to cook meals for the week and get those in the fridge, or just help meal prep while we're there. Um, Feeding services. Sometimes people, if they have something such as Parkinson's, or ALS, anything neurological like that, they may have issues with eye-hand coordination. We can be right there with them to make sure that they can go and bathe safely. They can eat their meal, safely. They can do the things that they should be doing, with just a little helping hand.
Well, the beauty
You
of
know,
this also, as I see it too, you help keep people, you help keep people in their homes,
absolutely.
as
Yep.
opposed to otherwise, a lot of times people would have to go to a facility. Um,
Correct.
and so
Yep.
here they can still say, which is kind of nice. In
It is.
terms of
Yeah.
hours, are there restrictions as to how many hours somebody can stay?
Nope. Like I said, we do that 1 hour short shift minimum. So 6 hours a week is the minimum. And that's, broken up. Usually people would do that in like one 3 hour and then another 3 hour. But we go all the way up to 24/7. We even have live-in options. So sometimes somebody will call and say, "Hey, you know what? There's no way I want to move from my house. I've spent most of my life here. This is where I want to live until I pass away." And we can send caregivers in 24/7. We can even do a live-in, which is where we select a caregiver that works with a client and then ends up going and living with that client. And so they're there when the client's awake, they're there with them, they take care of them. They do sleep then at the house, they have their own living space, and then we send in respite or backup caregivers as well. That doesn't happen very often, because I'm not going to lie, it is quite expensive. And it's also very difficult to find the people to match those shifts. But what I do think to your question about hours is no, we're just like a hospital. I mean, we're open 24/7. Um, it's very difficult to get people overnight, of course, but we absolutely have people who prefer that. Um, and you mentioned in facilities as well. You're talking about like independent living,
Right. Yeah.
assisted living, skilled nursing. So we can go into any of those buildings and provide private pay services where a home health provider cannot, because they can't go into a nursing home and do
Interesting.
nursing because that's duplication of benefits. But at Visiting Angels, if somebody lives in independent living, well, we can keep them there as long as possible before they have to move to assisted. And then same thing, if somebody's in assisted living and they have different levels of care, let's say they're in between two levels, like they don't need everything that a level two gives them. They just need help remembering to take meds twice a day. Well, if they're in a facility where we do community care, then we can do 15-minute visits and just have somebody go in and check on Miss Smith and make sure she took her meds and she's up and ready to go to breakfast. And then come back at lunch, do the same thing, come back at dinner and check that. We have a thing called the Angel Tuck program, and that's a bedtime program. in communities where we're partnered, where we go in and make sure that everybody gets, showered up or whatever they need done and tucked into bed for the night safely and, with the assistance needed.
Talk if you would, Chandler, how dementia care and Alzheimer's care
Hmm.
comes into play.
Yep, I'm really glad that you mentioned that. So dementia and Alzheimer's, it's on the rise. I
Right.
mean, I think anybody who watches the news knows and hears the statistics that we're seeing a lot more people with it. We're also seeing people who live with it a lot longer and a lot healthier, because of some of the medication that's out there, some of the therapies that have now been, kind of tried and true. So we have actual programs that our caregivers can go on because we do train our caregivers and they have 1 month, 3 month, 6 month, 1 year where they have to go on. They do online trainings to kind of hone their skills and also learn some new skills to offer in the home. Dementia is one of those. So, we understand that dementia care needs you can train for one client with dementia and somebody with the exact same type of dementia and they react to it completely differently. So our caregivers can train and learn on what to look for with dementia, how to deal with somebody that has Alzheimer's, that's say sundowning, which we see in the afternoons and evenings when that diagnosis tends to really rear its head, and we get a lot of effects from it because the brain's tired. Our caregivers are trained to go, okay, Miss Smith's getting tired. We can tell she's starting to get a little more aggressive. Let's make sure that she's in her room and comfortable and all that because again, we become part of their lives. And their comfort and security is our A1 priority. And so if somebody has dementia or Alzheimer's, we have special ways of dealing with that to make sure that they get the care they need and deserve.
And since you mentioned it, Chandler, let's talk a little bit about then your caregivers. So,
Hmm.
first of all, I assume, I guess you have two groups of people you're looking at. You're looking at people you can provide the services for, but you're also
Hmm.
looking for people to hire to do
Hmm.
these services. And I guess that's
Always.
kind of all you're always looking for them.
Yep.
So, in terms of somebody wanting to become a caregiver for you folks, what are you looking for and how do they go about finding the job?
So the one thing that we stress to all of our caregivers is that you have to have passion. You have to have passion for what we do. And so people always ask, well, how much experience do I need to have? Well, we prefer that you have 1 year of caregiving experience. Oftentimes that's for another agency, that's for a facility. You might have worked in the hospital as like a unit tech or a CNA. And oftentimes it's also with family. So if somebody's been a family caregiver for a number of years, taking care of grandparents or parents or whatever, we welcome them to apply and make a career out of something that you're passionate for. So what we look for is not a bunch of letters after names or degrees on walls, that kind of thing. Those are great. And I mean, and we welcome those folks with open arms. But what we're looking most for are the people that they see their own parents in their clients. They see their family in the people that they take care of. Because then there's that passion that we can't teach. You
So,
can't teach a passion to love other people, and that's what we want our caregivers to always do.
so if anybody would be interested in becoming a caregiver, not only
Hmm.
for your organization, but throughout the country with
Hmm.
Visiting Angels,
Yeah.
it's on the website or
It's on the website, so you can go to visitingangels.com/Asheville. Or you can just go onto the website and in the search bar put in Asheville, North Carolina. It'll bring up everything that they have. The other best way, if you want to become a caregiver, is to go on Indeed. That's our main posting platform. And we always have job postings up there. Sometimes they will have an area like a territory, and because we may be hiring for a case or certain number of cases in an area geographically. And sometimes it's for a timeline. So it might be if you're free from 3 to 9 p.m. weekdays, we're looking for people to fill that. But we are always hiring because there are a lot of people that need our services, and we like to be able to offer as much work as possible to our caregivers. But by doing so, take care of all the people that need it. So we need people for all times of the day, all days of the week.
Now
The number one thing that they need is passion.
you mentioned another organization. Did I catch another name? You said Missing Angels, and then what was the? It's just Indeed, or there was another.
Indeed. Yeah, I'm sorry. Indeed, the online hiring platform.
Okay, so talk about that. So if somebody's listening, Chandler, first of all, your website, and we're mentioning this by the way because this goes out to not only people in Western North Carolina, but theoretically out throughout the
Yep.
country. So if they're interested, go to what visitingangels.com,
Yes,
and there's a place to put your zip code, I guess, or where you're interested.
there is.
Okay,
Yep, up at the top you'll see, and I believe it says, where do you need care, or where do you live, or something to
right.
that effect. But basically, it'll point you in the right direction, and you can put that up, and it'll bring you to our local landing page, and that's where job positions are posted, and that's also where we post any announcements we have, upcoming trainings, awards, that kind of thing. Always gets posted on that same site.
So as we speak, I'm just looking, and it's very easy to use. I'm looking at the, I guess, the national website,
Hmm.
and I just punched in the zip code, and that'll take me to the Asheville location.
It should. Yep.
Yeah, there it is, caregiver jobs
Perfect.
in Asheville. That
Yep.
also takes me to the website overall for all the other stuff you do as
Yep.
well.
Correct.
The so if somebody was interested in a job, then they fill in
Mhm.
an online application, or what do they
Yep.
do?
Yep. They would click on that job and it would take them um to what we use called pre-intent, and it's just a company. It's a different website that works with our system, and it'll walk you through applying for the position. And then once that application goes in, then you'll get a call from our recruiters, and one of our recruiters will reach out and set up time for a phone interview. We do a phone interview. Of course, we do an extensive background check, drug test, and DMV check if we're going to be, if you were going to be transporting clients. Then once you pass that phone screen interview, you may be asked for an in-person interview, or you may be invited to orientation. We have one orientation every week, sometimes more if we have enough people. But we do have one orientation every week, and we will walk you through the onboarding process leading up to that orientation. And our goal is when you come up for our orientation, it's 4 hours. You are paid for it. That you come to orientation, and when you leave that day, that you leave with shifts on your schedule. That's our goal.
And
Because the second thing, other than being the go-to home care agency for the area, is that we want to be the agency to work for. Like we want caregivers to talk to each other and say, "Man, we want to go to Visiting Angels because that's where the life is good."
okay, so Visiting Angels in Western North Carolina, how big is I mean, how many employees do you have there, and then how many Visiting Angels do you have on staff typically?
Sure. So, office staff, we don't have really that many. We have three schedulers, two office assistants, two office managers. Then we have a recruiter who's also a marketing person. And then we also have another marketing person down in my Lenore area. But then you talk about the bread and butter of who we are, which is our caregivers. And in Asheville, I believe we have north of 60
Okay.
currently, and then between 40 and 50 down in the Catawba area.
Okay, so if you come on board, chances
Mhm.
are you're going to be pretty, pretty busy if you want to be.
If you want to be busy, absolutely. We always tell people if you're if you have good open availability and you're flexible, we can definitely put you to work. We have people, this is another great thing to mention. We have some people who come in and they don't want to work more than, say, 12 hours a week. They're just doing something while their kids are in school, maybe, or something's going on. So they come on, they let us know initially 12 hours a week. And so the schedulers know that that's the availability, and they'll only place them in times that work for that. As you can imagine, that's pretty limiting, if you have a very tight schedule. So if you are somebody that has a more open and flexible schedule, and you say, I want to work 40 hours every week, we can pretty much get you to 40 hours. If you're open and flexible, we can have you working.
Okay,
Um,
as you mentioned,
mhm.
so describe again. So it's all Asheville, and you mentioned you're elsewhere outside of
Yep. So that's in
Asheville.
Lenore, and that's down in Catawba County and Caldwell County. So that's going to cover Hickory, Rutherfordton, Lincolnton, um, obviously Lenore, Boone, Banner, Elk, Blowing Rock, those areas.
And you're involved in those areas as well.
That is part of our franchise. Yep. So I'm the head of operations for both agencies, which is one company as a whole, the umbrella company.
Aside from the branch we're speaking with, Western North Carolina, how many other branches are there through Visiting Angels?
Don't
Ballpark.
quote me on
Right.
this, but I want to say there's around 150
Okay, so quite a
total,
bunch.
quite a few. Yep.
I mean, do you have any folks who start with you and then work elsewhere, or can they go to some of
Absolutely.
these other offices?
Yeah, we never limit our people to say you can only work for us, but we do prefer and ask that we be your primary employer, meaning that you would give us your availability. And then if we're not able to staff, those hours, then you would go to another agency or to somebody else. But yeah, we have a lot of caregivers who work what's called PRN. It's kind of as needed. And they'll give us what their availability is. And if we have a need that fits it, then that's when we schedule them. And they may also work for another agency doing the same thing, and they're able to manage their schedule that way. So yeah, that's absolutely fine.
And you were telling me up there, I think I'm getting the hang of this now, the Visiting Angels, some of them do drive, they can drive. Um,
Absolutely. Yeah. Yep. Transportation is included as part of our services.
can they use the person's car or they have to have their own vehicle?
They can use either. Part of what we have as a requirement for work is, that you have an operational cell phone because we use an online system and an app to make it easy for our caregivers to chart and clock in and clock out. And that the other thing is to have reliable transportation. But oftentimes when we're providing transportation, it will be with the client's vehicle because it's what they're comfortable in and it's what they're used to. And so, as part of the onboarding documentation, we get all the information for the client's vehicle so that we have their insurance and everything, and that way we can provide it in their car if that's what they, so choose.
Looking down the road, where do you see Visiting Angels in, say, 5, 10 years?
If I
Larger
were to
or different services?
I would say yes and no. We're always going to focus on our core, and our core is non-medical private home care. That's our passion. That is what we do the best, and it's what we will continue to do. Now, I'm not going to say that there won't be additional service offerings over the next 3 to 5 years. We may look at offering something that's home health based. We may look at something that's more like a care manager. Some agencies do that. But for us, our big focus is continue to provide the stellar care that we provide and just grow what we do now, to touch more communities, more geographic areas, and to be the go-to agency for folks to come to when they first realize that they need some help at home. We want to be the next word that rolls off their tongue, based on our culture and the fact that we love what we do. We love our caregivers. We treat them like, I mean, for me as the head of operations, my customer, I have two. My customer is my caregivers. I have to provide a service to them that makes them want to stay and be good caregivers. And then, of course, my other customer is the end user, the actual client. So in 3 to 5 years, I hope and I want to work to see that we're the premier home care agency for all the counties we cover.
And one final question caught my attention looking through the website.
Sure.
Long distance caregiving. What's long distance caregiving about?
So what that means is having a loved one who doesn't live in Asheville and knows that mom or dad or whoever it might be needs help. And so they're trying to be a caregiver from 5 hours away. They might live in Wilmington or in Florida. We have clients whose POA, their power of attorney, is usually a child, a son or a daughter, and they may live eight
Right.
to 10 hours from here. They can't make it to come see that mom's doing okay. They can't come by on the weekends and just make sure that things are being done the way that they like it being done. Um, and that's where we come in. We have a program that's part of our Access Care that we use that allows families to register for a portal, and they can get the notes that our aides write at the end of every shift. They can actually see what the aide said. They can see that the caregiver said, Dad was a little slower today, or he wasn't having the best day, he was upset, and it allows those distance caregivers to check in on their loved ones.
Crazy question, but maybe a very
Yep.
appropriate question coming into the Christmas season.
Yes.
Can this also be a gift item for somebody to give or get?
Absolutely. We have a program that's basically a respite program.
Right,
Well, it's really for post-surgical. And what we do is we charge a flat rate, and that gives them 24 hours of care. And so if somebody knows that they have, like we've had people that just had LASIK surgery
right.
on their eyes, and they need somebody there for 12 hours. So we have someone there with them. Then they go in for their second eye, and we're there with them for, after that. So in that regards, yes, if somebody wanted to call and say, you know what, I want to get my nephew 30 hours of care,
Right.
and we would walk him through how he would look at something like that and, absolutely try to meet that request in the long run.
You got me thinking, and I'll leave you on this thought
Yeah.
that almost be reflected on your website because again, people, I'm just looking at it, you have a great
Yeah.
website, very informative,
Thank you.
but people don't think about that you
No.
can help out a loved one, just like you said, the 30 hours would make the difference. And
Hmm.
who would have thunk, that, and then they don't have to try to find somebody,
Right.
contact the
Right.
visiting angels. So play with that
Exactly.
idea. Just I think what a great service you'll be offering to loved
Well,
ones.
and something that I really want to stress to all the listeners and all your subscribers and everything. If you have a question about home care, if you have a question about what we do, what we don't do, how we do it, programs we have, payer sources we accept, how the whole process works, just call us. Call us or send a question on the website. I promise you, a real person is going to read it, is going to respond to it. We prefer to have people call in and just talk to us about what they think their loved one needs or what they may need and let us walk you through the questions to ask yourself to see how much care. And what I will close with that is we do start every case with a nurse. So an RN comes out and does a nursing assessment on every client we have. That involves an occupational assessment as well. So that's looking around the house, make sure they're safe. Do they need grab bars? Do they need a ramp? Um, and then an actual plan of care is written, signed off on by the client, the family. So we do have nursing eyes that watch for it. And if somebody starts to get sicker, or we start to notice that going on, then we can contact the family and say, "Hey, we're noticing some decline. You might want to get them in for an appointment," and we can just be that extra set of eyes to make sure that they're being lovingly cared for.
And one last time, if you can, Chandler, if somebody's interested in finding out more about visiting angels,
Mhm.
specifically in Asheville, but
Yes,
the best bet is the website. And what was the website again?
it's just www.visitingangels.com/Asheville.
Okay. And so I'd like to thank you for joining me today, Chandler,
Of course,
all
thank
that
you,
you've done
Blaine.
with Visiting Angels. I'd
Yep.
also like to thank my producer, Cappy Cassetti. Hopefully, we'll bump into each other again sometime in the near future, man. That'd be
I'm
great.
sure we will. Yeah, it's good
Okay.
seeing you.
Thank you.